Good afternoon, everyone. Thank you for joining the webinar for fiscal year 2014 Statewide Recidivism Reduction Grantees. Looks like we've got somebody from all 5 of our states on the line, so we can go ahead and get started. I also wanted to note that because there's so few of us on the webinar today, that we will be able to unmute the line and actually do Q&A by audio today. So for folks who haven't called in yet, you might want to consider calling in, towards the end of the webinar for Q&A, although you're also welcome to just type your question in, and we can unmute the line at the end of our presentation. And to do that, you can just click on the little phone icon under the participant list, and it will give you a call-in number. So my name is Phoebe Potter. I think I've met most of you on the line today. I am the Director of the Behavioral Health Program here at the Council of State Governments Justice Center, but have been working with the Statewide Recidivism Reduction Grant Program for a long time. I'm going to be presenting today alongside with my colleague, Dr. Heather Tubman-Carbone, who is a policy analyst with the Reentry Program at the Justice Center, and will be leading up the Statewide Recidivism Reduction grantee work this year for all the implementation grantees. So very excited to have her with us today. I am also joined with our good friend, Dr. Gary Dennis, Senior Policy Advisor for Corrections at the Bureau of Justice Assistance, U.S. Department of Justice, and he'll be talking a little bit today about the importance of this grant program from BJA's perspective as well. Before we get started, I just want to briefly talk through a couple of house cleaning items about how the webinar will work for those of you this might be new for. Anytime during the webinar, you can ask a question by typing it into the Q&A panel on the bottom right-hand portion of your screen. And this includes both technical and content-related questions. We'll try to reply to any technical questions that pop up as we go. For any content-related questions, we'll just keep tabs on those and address them at the end of the webinar. We'll do our best to get through as many questions you have as possible. I think we're in pretty good shape with an hour and a half to get through everything. If you encounter any technical or audio problems during the webinar, please call the WebEx technical support line. That's 1-866-229-3239. Please understand that there are some technical issues that we may not be able to resolve. For that reason, we are going to record the webinar, and we'll be posting it on our website at csgjusticecenter.org/NRRC. And we should have that webinar posted online early next week, and we'll also make sure to email it out to all of you. So with that, jump ahead here and give you a little bit of an overview of our presentation for today. So for starters, just want to do some quick introductions to both the Justice Center and the Bureau of Justice Assistance. But then we're very quickly going to go into an overview of the Statewide Recidivism Reduction Program, particularly the implementation process that you all are about to endeavor on. We will then spend a lot of time going through the planning and implementation guide that you will be asked to complete as a requirement per BJA for this grant. That P&I guide was sent to you in its brief, very shortly in advance of this webinar. There is also a link that we will drop into the Q&A box here shortly so that you can, in the chat box, so that you can find that there. And then lastly, we'll wrap up with Q&A. So we start with a little bit of introduction. I think most of you have now worked with us in the past. The Justice Center is a national nonprofit organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff here provide practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and strengthen communities. The technical assistance for this particular grant that you've received is provided through the National Reentry Resource Center, which is funded by the Bureau of Justice Assistance and managed by us here at the Justice Center. Through the National Reentry Resource Center, we're able to provide support to Second Chance Act grantees and the broader field. We're constantly adding new content and resources to our website, and we send out a monthly newsletter that provides information about the latest research, funding opportunities, distance learning events, and other news about reentry. To sign up for the newsletter, please visit the link on your screen after today's webinar. With that, let me turn it over to Dr. Dennis, again, Senior Policy Advisor with the Bureau of Justice Assistance, to talk a little bit more about their agency as well as their expectations for the grant. Gary?
Phoebe, can you hear me now?
Yep, we've got you. Thanks.
I know. As I said, it's amazing how quickly you become irrelevant in this world. Now, it's a pleasure for me to be on the call with the Resource Center today, with Heather and with Phoebe, because this is a very, very important project for BJA. A lot of you will remember 3 years ago when we worked with CSG to do the first national summit on recidivism reduction. We had teams from all 50 states, and our director, Denise O'Donnell, at that time, really was so motivated that she wanted to do more to address recidivism. So at that particular point in time, we decided that we would, in the next year, put up, I think it was, we ended up awarding $7 million grants for folks who were willing to take a stab at trying to develop a project that would impact the statewide recidivism reduction rate. And we know that a lot of people were really concerned about second chance because the way the law was written all those years ago, it's interesting to say all those years ago, it has been about 6. You know, the 50% reduction in recidivism in 5 years, we all knew was an absolutely unreachable figure. So we decided that we wanted to try to make that a little bit more reasonable. So we gave $1 million grants, and what we learned from that was that even though to some of us poor old country boys, $1 million sounds like a lot of money, but if you're talking about doing something to move the needle on the statewide recidivism rate, it really isn't very much. So we learned our lesson from that, and then 2 years ago, well, last year, we had the planning grants for $100,000, and I believe that we made 13 awards there. And those of you who are on the call today were the ones who had very, very competitive plans, and you were given the award of an additional $1 million this year with the commitment, as far as we can within appropriations, that we'll be able to provide another $1 million in 16 and another $1 million in 17. So over the 3 years, you'll have access to about $3 million to implement your plan. So the idea is that this is really the capstone to all of the money. Most of you know we put over $300 billion in second chance projects in the last 6 years, 5 years, and we funded over 500 grants. But these are the ones that really, I think, are going to be the sort of premier showcase grants. So we really, number one, appreciate the fact that those of you all put the time to do such a great job on developing your planning implementations or planning submissions. And now with moving forward with the work and the help of the Council of State Governments, we are really hopeful that 3 years from now, 3.5 years from now, we'll be able to look at this cohort of grantees and say, wow, they really did make a difference. They changed the needle, they moved the needle, maybe no more than 2 or 3 or 4% in terms of their recidivism rate, but the bottom line is we made some significant changes. So I just wanted to once again let you know that this is something that's very important to BJA and also personally to our director, Denise O'Donnell. So I'm going to turn it back to Phoebe, and I'm going to listen to the rest of the webinar, and I will be available at the end if anyone has any questions about what's going on with BJA right now or about this particular solicitation. So Phoebe, you want to take it away?
Great. Thank you so much, Dr. Dennis. Appreciate it. Okay, well, picture a map of the United States behind these states. I'll show it up in here, but as Dr. Dennis said, this is a really exciting opportunity for you all being selected in what was, as you all know, a very highly competitive grant program to be chosen for implementation funding. And so congratulations is the first thing I want to say to all of you for making it to this point. You know, having worked with all 13 states, it was really a very strong cohort of states, and everyone put a lot of really good work into this, and you all kind of rose to the top in terms of the most competitive proposals and demonstrating, you know, really strong leadership in your state as well to implement those proposals. And it was definitely a two-part consideration, I think, on BJA's behalf about who was funded. So congratulations to you all for being at this point. We're now going to talk a little bit more about the actual implementation process and the expectations around that under the Statewide Recidivism Reduction Program, and kind of give you a sense of where we in BJA are in terms of wanting to see really high-quality implementation that'll lead to those outcomes that Dr. Dennis alluded to, you know, in 3-4 years as these proposals roll out. So as you all know, at a high level, the purpose of the Statewide Recidivism Reduction Grant Program was to really fund statewide systematic changes within your corrections system that would enhance public safety and reduce recidivism. And those proposals are kind of oriented around these three different principles, right, that are found in the risk, need, responsivity principles. But making sure that we're focusing on higher risk offenders, using risk and need assessments to determine what services people are matched to, then providing evidence-based programs that have been proven to work through the research, and ensuring that the delivery of those services is high quality. And then thirdly, of course, deploying supervision policies and practices that really help promote successful reentry by balancing sanctions and treatment effectively. What does that mean structurally? We are now moving into phase 2 here. So you are the 5 grantees. We awarded these $3 million grants to implement the plans that you developed in phase 1 of planning. And this next slide, I think, is really the important one that we want to talk through with you about what we mean when we talk about the statewide recidivism reduction process. And I don't know that you've seen this explicitly laid out, but I think it will look very familiar to you in terms of the process that we went through during the planning grant period about the sorts of activities that you have undertaken and the sorts of things we'll now want you to undertake as you move into implementation. And this process is something that we've been articulating and working on over the last year, internally and with you all as states, and actually in partnership with APPA and ASCA and actually the National Implementation Research Network to help us think about what does it really take to drive systemic reform that is sustainable, that will last, that is really entrenched in the culture of corrections, as opposed to just superficial implementation, which we know happens so frequently because it's difficult to do high-quality implementation. And so this is the SRR process, and you'll find that the planning and implementation guide, as we go through it, is organized around these what we call components here. So component 1, exploration, is a big part of what you spent your planning grant working on, right? And this is really engaging and educating stakeholders about what it takes to reduce recidivism, then actually analyzing some of the relevant data about what are the drivers of recidivism in your state, which that was the analysis we went through to help identify an appropriate target population, and develop some recidivism reduction goals. So that's what you see there under that exploration phase. We also started to move into what we call the development phase during your planning grant, which was doing an assessment then of your system to determine, what can we change programmatically or through policy and practice to reduce recidivism among those kind of high-risk populations. And that's where we use the checklists in our P&I guide to help facilitate that assessment process. And then from there, moving to step 5, right, which is developing those specific implementation goals and a plan that's informed by evidence-based practices. So strategies 1 through 5 that you see on this chart are things that you've already accomplished and done in a very high-quality way, right, as reflected by the fact that you've been chosen to move into the implementation phase. In the planning and implementation guide, which Heather is going to be walking through with you shortly, we're going to basically revisit a couple of these strategies, making sure that we're clear as we now move into implementation. It's been a while since you sent us proposals in, right? Making sure that all of your implementation plan is really up to date, that we're clear about the recidivism reduction goals, and then we'll really spend some time thinking about these remaining strategies, starting with kind of revisiting what was your planning team to determine, does that need to change at all or become more of an implementation team now that you know what specifically you're looking to implement. So that's the first thing we'll want to focus on. And then we'll want to go into what we call the installation phase, which is actual implementation, right? And Heather will go through in more detail the different elements of a really intensive implementation plan that has administrative support, written policy and procedure, staff competency, all of these important issues built into it. And then lastly, and very important for this grant, especially, again, kind of echoing Dr. Dennis's note about wanting to see outcomes, hoping to see, a pretty significant impact on these very large investments that the feds are making, this accountability piece. And so we want to make sure that there is, both a process quality assurance element to that, but also that we're thinking about what sort of indicators can we track to, monitor that your grant program is having an impact, and including recidivism outcomes, but also intermediate outcomes, and thinking about how to sustain this grant well past the 3 years that you have this funding. So that's the SRR process. Again, new on paper, but I don't think new in practice in terms of what we've worked on together, but it's certainly the foundation and organizing framework for the planning and implementation guide that we've just sent to you. So that's what we're hoping to help you accomplish. Here are some of the more general requirements for you all as SRR implementation grantees, and this is from the solicitation directly, but as I mentioned, right, establishing some sort of collaborative steering committee, that's what we refer to as a governance structure here, developing an implementation work plan, right? So again, when we talk about having a planning and implementation guide that'll help you do that, that'll directly set you up to meet BJA's expectations. As you all know as well, hiring a full-time coordinator to staff that steering team and facilitate the execution of the work plan is a requirement under this grant. There's also an expectation for you all to contract with a third-party evaluator to conduct your evaluation, and so there's an exercise in the guide that'll tee you up for that. And then lastly, BJA encourages you to share data with us here at the National Reentry Resource Center so that we can work collaboratively with you to make sure that we're really tracking your grant and thinking about how to demonstrate the successes and impact you'll have with the stakeholders that matter to you. This is a visual when we talk about the requirement to track recidivism and outcomes and share data about what we're thinking about purely from the recidivism reduction outcomes. And I just think this is a helpful reminder. This is something you saw in our presentations last year with the planning grants about the expectation. But just to give you a sense of, the timeline that we're looking at here in terms of seeing the overall impact of these grants, BJA does require that you establish with, short-term and recidivism reduction goals. And so this is kind of a template to think about how would we actually then measure our progress towards meeting those goals. And so we'll go through this in a little bit more detail further down in the presentation. One of the last things here, as you gear up to take on this, intensive, long process, just a reminder that we, Heather, myself, and other folks on our team are being geared up to be support and provide technical assistance to you all through this process. I'm very excited to kind of continue working with you, picking up where we left off and doing this over the next 3 years to really ensure that you have the outcomes that you're hoping for. And so, your designated technical assistance lead, who at this stage will be Heather, and she'll be supported by other teammates in that, will be coordinating technical assistance for you in several areas, as you can see. So obviously going through and completing the planning and implementation guide, but also thinking about measures and strategies and ways for us to better track progress, as we talked about, and really important, providing just access to a really rich set of content support for you all. We have a wide range of consultants at our disposal, a lot of staff with expertise. We have the ability to come in and do trainings and facilitate meetings. So as you're thinking about your implementation plan and all that's ahead, please never hesitate to reach out and ask how we can be a support to you as you go through that. And then lastly, I think it's really important, again, with this high-profile grant program, that we're partnering with you to think about how to share your success stories moving forward. And again, same thing, right? This support is on an ongoing basis. It's accessible through a number of mediums. So just, again, don't hesitate to ask, and please see us as a partner of yours as you go through this to ensure that you have the best outcome you possibly can. So with that, I'm going to turn it over to Heather to speak about the planning and implementation guide specifically, how it tees you up to meet these expectations that BJA has set for this grant, and go through that SRR process that I outlined. So let me go ahead and turn it over to Heather.
Good afternoon, everyone. Looking forward, as Phoebe said, looking forward to getting to know your programs a little better and to meet you in the coming months. And so, I'm sorry, I skipped a slide here. So as Phoebe mentioned, the purpose of the P&I guide is really to help you meet the BJA requirements for a solid work plan, and to just really be planning ahead and think about the little sticking points in the implementation process. And so we've developed the P&I guide as a resource to help you first develop that work plan, and then also, as Phoebe alluded to communicate your progress with key stakeholders. And that's something we'll talk about a little more as we go through the guide. Given that recidivism outcomes won't be, or recidivism reductions won't be realized for a few years, we think it's pretty important to make sure that everyone can maintain a high profile and celebrate some midterm successes. The P&I guide will also be useful to identify technical assistance needs and for us to develop a plan to address any of the needs that you bring forward. And then lastly, and I guess sort of most importantly, is also to, as we said, help you comply with BJA expectations for the grant. All right, so this is just a quick overview of the three sections of the guide. As Phoebe said, the guide follows the SRR process, those four components of exploration, development, installation, and accountability. And you see that exploration has sort of fallen off here because that's what you completed during the first phase. And this guide will build on where you left off at the end of FY13. Please know the guide is designed to be highly flexible, and we want it to be relevant to the specific recommendations and the plans that you've identified within each state. So we'll start with the first section that addresses development. The development component of the SRR process, as Phoebe read through the specific strategies before, it's really designed to help you identify barriers and gaps, think about what might be some limitations to the implementation process, and perhaps most importantly at this point, establish a governing structure. And in order to do that, we've created a couple of exercises, or a multi-part exercise, which is intended to help you identify first the activities that are supported by the grant, then to clarify your recidivism reduction goals, and lastly, to establish that governance structure. And what we mean by governance structure, of course, it will be, the structure will be unique to every state, but we think about something like an executive steering committee, which is followed by a core team, and then after that, there may be some like topic-specific work groups who can really dig in on specific issues, and everybody can report up in order to make sure that things are implemented as planned. This will be the first series of exercises to complete under this new P&I guide, and they'll be due at the end of January. And it's also important to note that the first part of this exercise will walk through the major activities supported by your grant, and because we're focused on implementation at this point, those activities will carry forward to all of the subsequent exercises. As you complete that first section, just a quick note about some ideas for TA support. As Phoebe said, and as you know by now, we're here, we're ready, and we want to be as supportive as possible. Some ideas, we can provide some guidance on composing your implementation team, participate in or facilitate meetings. One thing that might be particularly helpful is that we can share sample mission and vision statements, memorandums of understanding, some organizational charts, and additionally press materials to help generate enthusiasm around your grant. And of course, lastly, and this goes, you'll see for every section, we can also provide objective feedback and recommendations. And now to jump into section 2 about installation. So you'll see again, these are the three, on this slide we have the three strategies that Phoebe walked through that comprise the installation component. And this component of the process, as you know by now, is designed to ensure that the evidence-based policies and practices are operationalized based on research about effective implementation strategies. And for the most part, that really just needs to be incredibly planful at this point. You've developed these great plans, you've thought through the evidence-based strategies, and we want to make sure that they're implemented as you intended. And so to that end, the purpose of the exercises in this section are to develop that work plan that's required by BJA. And so this exercise consists of 3 parts, and you'll be prompted to inventory the administrative support, policy and procedure changes, and even the development of staff competencies or trainings that you might need in order to effectuate the activities as planned. This exercise may be incredibly valuable to you because once you complete this inventory, it can serve as a checklist of things that you should have in place in order to proceed as planned. This series of exercises will be due at the end of February. And as I said before, this will sort of build on that first one. So you've identified the major activities and your goals, and at this stage you'll be taking an inventory of everything you need to make sure that they can be implemented. And again, we'll be available to provide any support that you need. Similar to in Section 1, we're suggesting we can provide guidance on policy and procedure development, participate in or facilitate work groups. At this stage, information sharing could include, again, sample policies, but also manuals. You know, one thing that we've done in the past, and you may have even experienced this yourselves with us, is that there's often a lot of development work to be done around referral processes. And so we can help come up with a process, develop forms, and provide examples of other processes that folks have used that have been pretty successful. And of course, again, we can provide objective feedback and recommendations, such as providing trainings, suggesting consultants who may provide trainings, and other resources. And now on to the third section. So this is the section on accountability. And at this point, which will be a few months down the road, we're really talking about being responsive to BJA's purpose for the grant, which is, you know, 1, to promote fidelity to the evidence-based practices, 2, to really document what you're doing and how it's working so that, assuming, and I'm sure we will, all find great outcomes and realize great reductions, but we want it to be able to be replicated in other settings, and so that will require a substantial amount of evaluation and documentation. And the last thing that we have under accountability is sustaining activities through continuous communication and improvement. And the exercises in this section are really designed around 3 steps. So the first thing, as you can see in this graphic, is to meet that requirement to track statewide recidivism rates. And you're asked to do this around sort of 6 cohorts, if I may say it that way. Is you have your full population and then your primary target population. And on that graphic that Phoebe showed earlier with the timeline, you're supposed to be tracking three years worth of each cohort, or 3 release years. The second piece of this is to identify the appropriate evaluation methodology. And there should be a process evaluation for all the major components of your SRR program, but as far as impact evaluations, that will really have to depend on the nature of the activity. And we know that that will vary across and even within states based on what all is going on and the different stages that everyone finds themselves at each point in time. And so we've listed here, you know, sort of the 3 broad categories of types of impact evaluations. And you see number 3 is to actually execute the process and impact evaluations. In order to get there, we have a few exercises just to help you plan from the front end. So the purpose of these exercises, as you can imagine, is to promote quality assurance and sustainability, and also to be thinking forward about tracking performance indicators and preparing for evaluation. And part of what we'll do in this section of exercises is also to sort of tee us up to identify those midterm outcomes that we can use to generate success stories and to celebrate the success of the program, given that it will take a few years to really assess the recidivism reduction accomplishments. So this exercise has 4 parts, and in it you'll be asked to consider some quality assurance strategies, so the different ways that you can check on how your implementation is going. And so rather than waiting until a process evaluation at the end, this exercise will ask you to identify some benchmarks and some ways that you can see if things are going as planned, if the proper resources are in place, if the resources that you have are sufficient, and that will allow for, let's call them midterm adjustments or edits to your implementation and activities. The exercise will also have you think about tracking and communicating progress and outcomes. And when we talk about sustainability, as well as the implementation pieces of it, we're really thinking about making sure you circle back to your staff and let them know, here's how things are going, here's what's coming up next, and then also to talk to stakeholders to make sure that you're either maintaining or garnering more support. And then the last piece of this exercise will be to plan for process and impact evaluations. And so simple things from the get-go, like identifying what your data elements will be and to make sure that the mechanisms are in place to collect them, or that they will be put in place at the start of activities so that nobody has to go, work backwards and go back and collect data, because we know nobody wants to go through a manual paper process. And so one last thing about these exercises, in the P&I guide that we sent and that's available through the link on the site, you'll see that the exercises for sections 1 and 2 are all contained within the guide. For this section, there's one exercise that will be done in Excel, and so we haven't sent that. That's not part of that Word document, but given that the due dates are staggered, we will send that as we're getting closer, so while folks are working on section 2. But of course, if anyone has any questions about it, we can certainly address those at this time. And then lastly, for section 3, some TA support, similar again to what you've heard before. The difference here would be that we are also thinking about evaluation support and help coordinating with your research partner. We know folks usually have someone in mind or someone they commonly work with. If that's not the case, we can help you to think through who's the most appropriate partner. And then we can also help dig into the details, like defining data elements and developing data collection protocols. As far as those intermediate outcomes or midterm successes that we hope to capture, we hope to be part of that too, to help monitor progress and accomplishments. And in doing so, one of the goals there is to promote SRR efforts and their achievements, both within and beyond your state. So we can help with things like preparing materials to share intermediate outcomes or progress, developing presentations, and offering press release templates. And then, of course, as always, we are here to provide objective feedback and recommendations. And this slide is just a brief overview of the due date. So as we said, section 1, which focuses on development, will be due to us at the NRRC at the end of January. The second section will be due at the end of February, and at that time we'll share the remaining exercises for section 3, which will be due at the end of March. And as you experienced last year with the P&I guide, we'll go through some reviews, some conversations back and forth, and then everything will be sent to BJA at the end of April in order to satisfy your requirements. And this brings us to the Q&A portion of the webinar. Thank you for hearing all this, for bearing with us, and we are happy to take any questions or comments that you have at this time. You can either type them in into the Q&A boxes, or please feel free. We can unmute the lines on the phone so we can have this as a conversation.
I just want to add to, this is Phoebe, that we held off on sending the P&I guide until the webinar with the intention of kind of giving you this orientation before you read through it. So I'm sure additional questions might pop up once you've spent more time with it, and we'll be happy to take that by email or phone as well. So with that, any questions? We did unmute the line, so you're welcome to just speak up if you have anything you'd like to raise.
Phoebe, this is Monica in Vermont. How are you?
Good. How are you, Monica?
So, I mean, I understand everything that you and Heather presented, and one of the things I see is really important is getting our full-time coordinator, which requires approval of our budget and ability to, start hiring people. So I don't know if that's something that Dr. Dennis can address, or if there's anything you have any insight on.
I'm going to give Dr. Dennis a minute to unmute his line if he's there.
Well, I think that you're going to have to refresh my memory. Who is the program person that is working with you guys on this?
It's Anya.
Anya. Anya should work with you expeditiously to get your budget cleared. Do you have any idea what the hang-up is?
No, I just haven't really heard anything from her, so I was just curious if there was something. Okay, so I can do this.
Yeah, do this for me. Send Anya an email, ask her if there's any hang-up or any problem in terms of clearing your budget. Copy me on it, and we'll see if we can't get that straightened out, because unless there's some major problem, we should have those budgets cleared by now.
Okay, and I might have misunderstood where we were in the process, so thank you for that. I'll follow up with her.
Yeah, once the budget's cleared, then you're free to go and move ahead to hire the person there. And give Commissioner Polito my best regards, please.
I sure will.
And I saw there was a a question in the Q&A box from Dennis Wiggins about the deadlines for the planning and implementation guide itself, and there's absolutely, as always, flexibility here. If, you know, there's certain questions you just simply can't answer yet because it's being held up with decisions that are tied to your budget, that's fine. I do think it's worth, though, looking at those exercises. I think a lot of them can be thought about in advance. Appreciate that the full-time coordinator is probably helping you write that, so I'm happy to work with that. But thinking about what stakeholders should bring to the table, just revisiting the plan itself and articulating those activities, some of that can probably be done, you know, in the short term. But as always, just give us a, you know, let us know if you're running into anything. If we find that a lot of states are in the same place in terms of deadlines, you know, we can always make an extension if that makes sense for everybody. Any other questions from folks on the phone?
Heather, this is Monica again. Will you sort of be reaching out to us separately about things just to kind of check in and find out what's going on, or are you going to wait till you receive questions from us?
Thank you for asking. Actually, I wanted to wait until after we got through this webinar just so that everyone was in the same place, but I plan to, within the next few days, to reach out to everyone individually. I know we've already had contact with some folks who have pre-scheduled meetings that we should be attending, but my plan is to reach out, to schedule some site visits and some phone calls to make sure that we're ready to hit the ground running, and I'm, you know, fully prepared to just jump right in. So you'll definitely hear from me within the next few days. That being said, if you have any questions at this point about the P&I guide or about anything else, please don't hesitate to reach out.
Thank you.
One of the things that I'm going to put out a question to you all because why not? One of the things that with a smaller group of states now, with just the 5 of you, that, you know, it kind of is conducive to more kind of peer learning opportunities and bringing you all together more frequently to talk about challenges and things. I'd love to hear from you on the phone just off the bat if it would be helpful for us to be setting up these kind of peer learning, you know, whether it's a webinar or conference call, maybe on a quarterly basis or something like that, for you all to come together and talk about common challenges?
Amy, this is Jay Sanders in Georgia.
Mm-hmm.
I think it would. I know when we were able to go to the conference in D.C. earlier this year, it helped to be in the same room with some of the other 13 states and listen to what their challenges they were facing. So at least from my perspective, it is helpful, you know, to occasionally touch base. Great, that's really helpful feedback. And I don't know if anybody else has any thoughts. Let me know if you feel strongly not. We'll assume silence is an affirmation that that's helpful. Okay. We set you up for not being able to say no, obviously. But so great, that's helpful feedback. And we didn't mention in the webinar, but you know there are going to be opportunities to in-person come together as well. You know that's budgeted in your grant. You know the Second Chance Act conference. We're feeling pretty good that that'll happen this year. Official confirmation should be coming soon if all goes well. So that'll be an opportunity to come together. And then we'd like to do another SRR-specific convening, kind of like we did in March last year, probably a little bit later than March this year, just because we know the planning process was very front-loaded. This will take a little bit longer to get off the ground, so we want to make sure we time it so it's at a point when you all have a lot to share and talk about. But we do plan on having those 2 opportunities for in-person meetings.
Yeah, and part of the thinking too, excuse me, I'm sorry, about having that SRR-specific convening a little bit later is that you'll be a little further into that implementation process, so there'll have been more of an opportunity, I hate to say this, but realistically there'll have been more of an opportunity for some of the challenges and impediments to crop up, and I think that's really where the peer learning will be the most helpful. So we don't want to jump the gun and potentially miss that great opportunity.
Any other questions or thoughts? We're always happy to wrap up early, as you know. You know, again, I know you didn't have a whole lot of pre-time to go through the guide, so definitely encourage you to take a little time to go through those exercises. You know, I think, as Heather mentioned, you know, we really made an effort to make it kind of a flexible guide that's tailored to the specific activities you're funding, knowing they look very different state to state. So I think you'll see that reflected in how the exercises are structured. So hopefully that's helpful for you. You know, definitely if you're running into things that you've already thought about or, you know, presentation-wise, it would be helpful to shift it a little. You know, we're always flexible on that too. So don't hesitate. Heather will be reaching out to set up, you know, one-on-one conversations with you all. We can talk about it at that time too in a little more detail. But it is really important to us that the different elements of the guide are being addressed in some form, as you know, because they are in line with kind of the expectations that BJA has set and is looking for in terms of both quality implementation, but also kind of tracking outcomes. So that's where we are. And I don't know, Dr. Dennis, if you had anything in closing that you wanted to mention.
No, I'm just really excited about this process. I think we finally reached a point where we can, you know, the 5 states are, you know, we're certainly really strongly supportive of their commitment, and I'm just excited about the outcomes of this. And I hope that we'll all be around 3 years from now to see the difference. Thank you.
All right, thank you all, and congratulations again for having this award. It's definitely a testament to all of your work, and we're very excited to work with you over the coming years.
Thank you.
Thank you.
Thank you.
Bye.